I'm really very glad to be here among you. Really, really excited, I would say. And it's an opportunity for me, to expand, to extend all my knowledge. That thanks to collaboration with the School of Art Therapy from Haifa and the people there, especially Rachel, but also her colleagues, with whom I never stopped to have communication, to ask them, their impression and their their analysis, if you like, of drawings that you were used. Here we can see now I think I have to wake up. So as you can see, my presentation is about trauma and traumatic relationships. I will explain. First I have to find out how it works. No? This is. Okay. So we're working with schools. Now I'm working in the education department. As you could see, we have a laboratory and we have a master program in school psychology. And that's why we have the opportunity to receive a lot of, we're not a clinic, a classical clinic. We have a laboratory. It's not a first line, service, but we can receive a request from schools, so we can see children, families, and especially our way of working is to meet both parents and children. Depending on the case, in most cases we see first the parents, so to understand what's going on, or listen to their story, etc. And then depending on our first assessment, we choose to maybe to have a second meeting with parents, maybe to work exclusively with parents, and in this case we also see a lot of changes. Believe me, trust me, there were cases that we never saw the child, and thanks to the work we have been doing, we have done with the parents, this changed a lot. But this is not hard, I think. Okay, so just very short, things that I'm presenting here, and then I'll show you some drawings and some of the clinical cases that we have encountered. Our clinical practice have revealed family new forms of emotional and relational dynamics, as well as deficient parenting practices that may have a traumatic impact in less obvious social and family pathological context. So this is not the cases of extreme abuse or sexual abuse or these kind of things. As I said, of course, there were cases where we found out that there was a real violence, a lot of violence in home, but this is very, very few cases. Usually we see children with emotional behavioral disorder, disruptive disorder, and what, of course, we have seen is that caregiving practice are often distorted by parents' past traumatic experience, hidden, concealed, or excluded from their conscience. And this is something with the years, always, it's maybe because we focus, and I personally focus, give much more attention, then we found out the stories of the traumatic past. That's why we came out the transgenerational transmission of trauma, something which is well known, but we found it almost in every case now. If we had much more time, we could mention and report many cases, specific cases, very normally in a way of mid-class, so very normal, in the scale of pathology, if you like. So, for example, the case of obsessive personality disorder, or what is called narcissistic mother, who seeks unconditional love and comfort exclusively from her child, or obsessive personality mother aims to have absolute control over the child's life. This is two cases that I have in mind and I'm working now. It's not something about psychiatric assessment, only a psychiatric diagnosis, but something that beside behind this, there are unprocessed traumas, as you can see here, or traumatic loss in some cases, and a fear of collapse, of course. And this can produce very alienate emotional interaction between the child, the parent and the child, and alienate and what's the name, the other name? Not distorted, πώς είναι το perverse, sometimes perverse, especially the case that this morning the father wrote me about this case that this conflicts, the mother and the child create finally children who hate. He found an article and he sent it to me this morning in the message. Anyway, here you have some findings about the Greek reality, about families, etc. And we can see that on the whole, on the global, up to 68 children experience some form of traumatic event. And it's important to say that as sexual abuse, also emotional abuse sometimes is underdiagnosed, misunderstood, and not taken so serious in consideration. So you see those who report emotional abuse report higher scores for depression, anxiety, stress, and neuroticism personality compared to those who reported only physical, only sexual, combined physical and sexual abuse. This is a finding. Of course, we can discuss it and you can see. So this is, what I said before about the findings in Greek that give us a picture of the modern Greek society that you can see that over 83% of young people report that they have been exposed to psychological violence, 70% in the past 12 months, and the lifetime exposure for physical abuse for adults, family or school was reported by 76.3%, of the children. Adults and children, So this is something that is very serious, we can see. And another research we found, this is an international research where was reported that the same rates, about 85% physical violence, but on the other hand, they say that their parents love them in a rate of 90-80%. So you can see this contradictory reality that might have a very, finally, perverse effect, conflicting and confusing at emotional level effect, So many diagnoses, it's ADHD, which is in fashion now, the ADHD diagnosis has really increased, not only in the United States, which 10 times more than in Europe some years ago, even in Europe, or developmental and emotional immaturity. This is our official formal diagnosis. Conduct disorder, atypical autism may be rooted in pathogenic direction connected to parent, unresolved or unprocessed traumatic experience, which means that behind that there is something, there is the reality, the family reality, the relational dynamic, the emotional dynamic interaction, etc., and the whole story of the family, parent story, etc. So depending on the child's subjective perception, this is very important. We talked yesterday about how the child perceives the reality, and the way parents treat him or connect to him, or how do they act, etc. in the family. A situation may have a traumatic or disorganized effect. And here, what I found out, and that's hopefully the research started to focus on this. If ADHD, it's mimic trauma, or trauma mimics ADHD, which means that in many cases of ADHD diagnosed, we have traumatized children, either in the family context or the school context, victimized. And in the case of disruptive behavior in a boy due to father absence, there are very critical periods, for example, when the child at 7-6 years old, when the child entered to school, primary school, which is a turning point, how do we say, just a critical point. Okay, that's missing now. It's I'm missing now in both in Greek and in English. It's something that a milestone, a developmental milestone. It changed, Many children in this age, they need the father, especially boys, need the father figure as a reference, because father is considered to be the third person, is the one who's supposed to open the child to the social world, to the social institution, and take off of the very, very close and attachment to the mother, to the psychoanalysis used to use the term symbiotic relationship. So the third person is somebody who takes off the child and inserts him, introduces him to the social world. And I think there is something important in this conception, something very useful to understand the developmental pathways. So behind many, many disruptive behavior in boys, many boys feel the absence of the father, not in extreme, I'm not talking about extreme pathologic situation, but even fathers who don't understand how they can connect or be attached, or how much their boy needs them, And also for the girls, the role of maternal role is very important, and hopefully started also to be studied this subject, the role of father. So, on the other hand, there is a shift on trauma-related perspective models in clinical practice. Now there are terms like traumatic relationships, interpersonal trauma, micro-trauma, episodic trauma, chronic or accumulated trauma, developmental trauma, which is also included in the official DSM diagnosis now, transgenerational trauma, complex trauma, or silent or covert trauma. This is a term that I use. I don't know if it does exist, but I feel that it responds, it reflects something of the emotional reality of children and the families. And then the notion of crypt that Abraham Torok, two psychologists from Budapest, from Hungary, many years ago, this is mostly in French literature, moved to Paris, they have used the word crypt. I don't know if you know this concept, which means a part, crypt is something, a kind of spot, inside the person, where the painful experience, which is totally foreclosed, totally forgotten. Tisserand have another French psychoanalyst has written an amazing book about the function of this crypt, where traumatized parents have experienced an extreme trauma, when they were children or adolescents, forgot it, totally out of the conscious, but this kind shapes finally their reaction when they become parents. And you can see through especially the presentation, the 15 minutes dialogue case, 15 therapeutic dialogue that I will present later, is this a typical example, I think, of this. Okay, so yes, in what I was saying before, the paternal symbolic function consists in helping the child develop internal boundaries, etc. Mentalizing capacity might be obstructed by father's personal deficits related to problematic personal history, vulnerable, deficient, or aggressive, hostile, abusive, etc., etc. Father is understudied, I think, still, even though. And I mention this, I report this because we find it in almost every case. Is not by luck, because when we'll talk about children of primary school, this is the first step to autonomy, when they socialize, they go elementary school, it's another kind of structure and environment, social interpersonal environment. In primary school, it's a microcosm, of the prototype of the world. So in their families space, this is my impression, finally, after so many years of working with these families, minor or major trauma, whether past or present. So this is always said. And I don't know if I have to check the time. So this is just a picture of the way we are working. Yes, but just to have, how many? 10 minutes, yes. You see. So this is, you can see here, how we describe the way we are working, providing a transitional secure space for parents, where we can open up rastas, etc., a containing environment, holding environment. We don't just use a verbal expression exchange. And trust me that parents, I would say the opposite of usual. We say that unconsciously they seek help, they need help when they want to trust us, but consciously sometimes they resist, etc. But very easily, okay, I think you read it, that very easily when they trust us, we can explore, their own history in a very simple way. Not necessarily use the drawings of trauma exposure, genogram, etc., but even by talking, they found out, and this is for them also something very important. I mean, it's a relief, because they understand that they're not guilty, that they also carry on. They have their own story that shapes finally the way they perceive or the way they react toward the children, and sometimes it's very important to refer to their own childhood because they dramatized or reduce the anxiety, then they feel and okay. So this approach deeper inside, etc., for the nature of the term. So I don't know if you know the Winnicottian, the term of Winnicott. A transitional object, transitional space. I think we use transitional object to facilitate our connection and, of course, to the verbalization expression. But I think that the art therapists create a total environment, a transitional environment, a whole environment, a whole transitional space, where they, with the way they work, Okay, so like some here, art-based production may not use, play we use, etc. And okay, I think you wrote. This is something about evidence-based practice, that it's okay, evidence-based we need, but especially in art therapy there is work Coleman and McIntosh who would say, if we focus only to prove that our techniques are evidence-based, are very, very effective, we might lose, we risk to lose, all these things, the creativity, the intuition, the real emotional openness from our side and from the side of to mobilize this, to produce this to the, okay. So now I will present, can you open there are 3 drawings. I will refer to just, yes, this is the first one. This is, I use this just to show you how finally just drawing something, even not in the way, not using the drawings the way our therapists use, it's make a lot of change. This is, as you can see, it's, and I will tell you my impression. I have just 2 drawings. The second drawing is much more striking, the case in general. So I go very fast with this one, and this one you can see here, no colors. This is actually a copy of mine because I have lost all this material on both my computer, and I try to copy, and the original one was much more strong and much more bigger, So when I mean, I have to find the, I think, here it is. This is the drawing of a child of 11 years old suffering from phobias. A smart, only child with a strong mutual attachment to their parents who had been systematically victimized by a group of older neighbor children. The child had withdrawn into the home, refused to travel with their parents from Crete to Athens, and expressed fears that the plane would crash or the ship would sink, etc., etc. It was only during the drawing activity that the child revealed in detail the episode and traumatic experience with the neighborhood kids. He revealed this while he was drawing the tree. A tree with a thin trunk, strong base roots in the ground, and very dense foliage that for me reminds me of eternal turmoil, fears, and confusion as this child felt. Next to it, there is a broken small trunk. There was one. It came up 2 for me. I had 2 trauma from it. And yes, And during the meeting with the parents, it was revealed that the child had experienced a primary trauma with the loss of his maternal grandfather when he was 3 and 5 years old. Terrified after the funeral of the grandfather, he said he cried to his mother saying, "If you die, I'm going to be buried with you." This is something that still makes me, chill, after so many years, because it was many years. And so how the tension of attachment and how the children at this age are attached, they cannot experience themselves separate of the mother. But in this case, it was a child of 11 years old when it happened. The comments about the drawing, etc. And now the third one.
But you draw it, right?
Yeah, no, this is a copy of his own drawing.
But what do you mean copy?
I did what he was doing. This is yes, I draw this.
Yeah, you tried to copy.
Yeah, but this is the impression.
What? He lost his.
I lost, yes, in the computer, etc. Yeah, but it's what the difference is. There are two pieces of drawings, I think. But I think it was more dense and more powerful, the first one. And this is, the third one. So this is, you stay here, yes. This is, as you can see, a house with just a kind of door, which is not a real door, and a window and a kind of antenna. So very brief, this is the second story, okay. Well, this is the second drawing depicts an empty house with no real doors or windows, etc., and a kind of antenna on the roof. This is Nicola's drawing, a 7-year-old boy diagnosed with atypical autism. The mother, in brief, I'm reporting, the story of the family. The mother exhibits a highly critical attitude towards both the child and her husband, Nicola's father. The father, unable to handle her constant criticism and rationalized aggression, he responds with violent outbursts, either outside the home or at work. During a individual session, he brought audio recordings of Nicola's dramatic shouting at his mother during nightmares, saying, "Mother, not possible, it's not possible." It was really shocking. It was shocking. The dream lasted a lot, it's just some few seconds normally. It was more than a minute saying the child repeated this, that affair to show me how finally critical nocive is the mother. Nicholas, on the other hand, has withdrawn into himself and developed a kind of autistic mask, responding with passive-aggressive behavior, ignoring all parental instruction and provoking their outburst against him, and even not physical, but very emotional anger, hostile feelings and attitudes. The mother harbors, on the other hand, immense anger toward both her husband and Nicholas. She revealed that she suffered from postpartum depression after the birth of her second child, neglecting Nicholas' need for more than 2 years. She also shared her own family history in detail, which involved a distant father in a family of 3 daughters, marked by intense rivalries and conflicts, and a mother who was unable to manage the family dynamics, also the father. So I became convinced that Nicholas, because I saw him, was not autistic. An amazing session with Nicholas and his mother became a critical turning point. While his mother was speaking, Nicholas was drawing, and this, what you saw, and drawing, and he suddenly turned to her. With a clear, decisive, and very reasonable tone, he responded to every comment and criticism she made about the whole situation. It was really fantastic for me. And he was a very clever child, since the first time I saw it, So the final assessment by the child psychiatrist a few months later was remarkable. It was as if the autism had slipped away. This is something some years ago, and the mother still now she's studying, the family have been, it's much more better. Every time she sees me, she hugs, she's so happy, that I helped both couples and Nicholas. And please note, I'm expecting your comments about this. Note that the antenna on the roof was a lighting rod to ground electrical charges lighting, not an antenna. Because when I said it to Michal, I wanted to hear impression. He told me this is maybe an antenna that this child is going to communicate, etc. But finally he said this, lighting rod. So all the aggressivity that absorb, he preferred, to be the target of parental aggression and than to see their parents, his parents, fighting, quarreling, etc., which caused much more stress, And of course, he had also the experience of the mother neglect, something that explains also his extreme withdrawn and this kind of autistic appearance. So this was just an example in the two cases of the way we work. We, in our perspective, is a classical psychodynamic perspective. We use narrative or projective measure. But very important for us is also to put words on it, but you do the same thing with the comments, I think. But the thing is that we are not special. I'm not special. I had some training years ago about abuse, drawings abuse, but I'm not a specialist, so I still use my classical way of meeting the families, the children, etc., and working with them. That's all. Looking for you. But just one more thing, I think it was said before, but just drawing, I think, is something that deliberate frame, it's something that, okay, with words, etc., we can climb trust, but this is very, very, it's 100 of children of cases that report and pay, then feel much more comfortable to, okay. Questions, comments?
The only, can you show back just for a minute? Yeah, the two drawings. It's a copy is very hard to really copy, even if you try to be very accurate. And why is because, for example, you copied it. We don't know if he did this X. Okay, and the same with the house, whether it's located at the same height, everything. So
okay,
it's
anyway, this is because I make a very general interpretation, if you like, the impression we got from the house, and but as you mentioned that there are for you are very important details that this I believe.
It's like we will not be able to really copy something.
Yeah, no, but this because I use it a lot of years, just for example to my students, especially this one, and
It's not for you. It's for
right. Yeah. And we'd like to show the second, another tree. It's there are three in the middle. I think it is the before thing. It's another small tree. This is also a child. It's striking how finally a little design represents the eternal and family reality of the child. It's a child that has been, the father is a Greek one, the mother is from France, etc., a psychologist, but okay, how he got married with this guy, it's another story. I know her story, of course, because after the father died, he found himself in Greece and meeting somebody on the beach. He was an affair with a married man. He didn't want to marry, and he found himself in Greece with this guy, etc. Nothing to do one with the other. She used to to read the Le Monde Diplomatique, it's high, and he was almost he was a carpenter, etc. A nice guy, but finally a lot of problems came out when with the child. And he has beaten sometimes very, considering this as very normal, to treat him as you're stupid and giving on the head. And once he kicked him, the child was really very traumatized. And this, I think, this is my interpretation, this the tree, the dry, etc. And the other one, the spot of flower, I think it's the mother care, the mother ring. And finally, I support her, and she divorced. She went to, and now she's living an excellent life in France. Have another relation. The children grew up, but have been working. She was very afraid, to live. It was not very easy.
Yeah, this tree.
So this,
weak and.
It's terrible.
Yeah.
I think that's the parts of his own.
Yeah, and the roots are outside, not in the
ground. I'm really, that's why I'm amazed, with this.